Hi, I'm Jim Kelly, Director for Health and Safe Design from SafeWork New South Wales. I'm here to talk to you today about SafeWork New South Wales and our role and how we can help you with managing the COVID-19 crisis. SafeWork New South Wales is the work health and safety regulator for New South Wales. We offer a range of services, including advice on work health and safety. We provide licences and registration, particularly for dangerous work. We investigate workplace incidents and enforce the work health and safety laws as the regulator. And we also do a lot of work in terms of injury prevention, assisting businesses preventing injuries in the workplace. So SafeWork New South Wales is obviously the work health and safety regulator and has a key role to play in managing the COVID-19 pandemic crisis when it comes to workplace health and safety. All businesses have an obligation to provide a safe workplace, and during a pandemic with an illness as contagious as COVID-19 is, workplaces must take steps to control the risk to their workers and others in the workplace. Whilst we appreciate this is extremely challenging times, SafeWork New South Wales has modified our response to ensure it's reasonable and proportionate to the challenges that small business and other businesses face. We have outlined our statement of regulatory intent on our website that essentially outlines how we will take a proportionate approach to our compliance and regulatory response functions to ensure that we consider the demands that are placed on businesses at present. Whilst businesses may be responding to public health orders that have a significant impact on your ability to trade or operate your business at present, SafeWork New South Wales will be reducing our regulatory burden through online or telephone means wherever practicable. However, we will respond to serious incidents and fatalities as they arise in the normal regulatory manner. We will take a supportive and educative approach when it comes to assisting businesses with their obligations to control the risk of COVID-19. We recognise this is unique times and businesses need assistance to create a safe and healthy work environment. This slideshow today will outline some of our expectations in relation to COVID-19 and how we can support and assist you. So a number of public health orders are in place issued by the New South Wales Minister for Health that place restrictions on gatherings and movement in general and specific restrictions on certain activities such as air and maritime transportation or those who operate in aged care facilities, for example. I urge all of you to familiarise yourself with the public health orders and the best place to go is the newsouthwales.gov.au website. These are changing and these orders may have a direct impact on your business. The orders to direct certain businesses to close, such as food and drink premises, pubs and entertainment facilities. However, special exemptions do apply and businesses are encouraged to review the orders on the website, as I mentioned. As of the 21st of April, travel for the purpose of work and gatherings essential for work were exempt from the 2-person limit ruling in a public place. A number of other scenarios are identified as essential gatherings and therefore exempt from the orders in relation to limitations to persons on a premises. These include gatherings at an office building, a farm or a factory or a construction site that is necessary for the normal operation of the business. Again, I encourage you to refer to the public health orders for these specific guidelines. An example would be for road workers and a local government work site, maintaining a road, they may need to gather in groups of more than 2. That may not be practicable to always maintain social distancing. However, where essential workers are required to do their task, this can be accommodated both within the public health orders and the work health and safety directions. SafeWork New South Wales is not responsible for the New South Wales public health orders. The New South Wales Police will enforce this on behalf of the government. SafeWork New South Wales, as a work health and safety regulator, is responsible for the work health and safety laws that apply to all businesses permitted to operate during this time. Employers must do everything that is reasonable and practical to eliminate the risk of a worker contracting COVID-19 at the workplace. And where not reasonably practical, they must minimise the risk to ensure COVID-19 is managed. In practical terms, this means that the business must do whatever is practicable to ensure physical distancing is maintained between workers, customers and members of the public. They must provide suitable amenities to control the risk of exposure to infected services, including regular cleaning, disinfecting, high-touch surfaces, and where physical distancing is not practicable, consider alternative methods of control, such as physical barriers or protective equipment where practicable. SafeWork New South Wales recognises it is not always reasonable to conduct the day-to-day operations of your business under these circumstances. In addition, supplies of key equipment may be difficult to obtain. These factors would be taken into consideration by our inspectors when determining what is reasonable and practical on a case-by-case basis. Employers are expected to consult with their workers to identify the risk of exposure and to put in place controls to manage those risks as far as is reasonable and practical. Particular attention should be taken to workers who may be identified as vulnerable, so those workers who are elderly, over the age of 60 years of age, or who are immunosuppressed. Specific controls should be in place to ensure that those workers can work isolated from others and maintain physical distancing. So all businesses and workers must comply with the New South Wales public health directions, as mentioned earlier. When it comes to workplace, the controls are simple but effective. Workers should maintain effective physical distancing or social distancing of at least 1.5 metres between workers wherever possible. And they should ensure they maintain good personal hygiene measures and cleaning measures to avoid spreading the illness and disease in the workplace. Workers should raise any concerns they have in relation to contracting COVID-19 with the employers, and employers are expected to consult with their workers in identifying those risks and control measures. Workers must work with their employer to monitor the extent of the COVID-19 in their community to ensure that they are abreast of the risk and take steps to respond to those as they arise. If workers or all managers require assistance and support, they can reach out to SafeWork New South Wales as the Work Health and Safety Regulator via our telephone number 13 10 50, via our online website, or via our Speak Up app. Regardless of the workplace, SafeWork New South Wales advises 3 simple measures. Firstly, hygiene practices. COVID-19 spreads through coughs and sneezes, as well as contact with contaminated hands, surfaces, or objects. It is vital all workplaces provide for and maintain increased hygiene and cleaning practices. This may include providing safe access to soap, fresh water, and hand sanitizer, requiring and reminding everyone to wash your hands frequently with soap and water, especially before and after eating and after going to the toilet or touching your face. Reminding workers to cough into their elbow, not their hands. If they use a tissue, they must put it in the bin immediately. Reducing the number of people handling the same pieces of equipment and regularly clean all surfaces where multiple workers must be using them. Increasing the frequency of cleaning and work amenities, and reducing the use of hard copy documents, e.g. plans by multiple workers. In relation to social distancing, sites should accommodate the government's health directions and guidance on social distancing wherever practicable. That is 1.5 metres between persons and 1 person per 4 square metres. Persons, including construction workers, must not participate in a gathering in a public place of more than 2 persons unless this is required for the work you are undertaking. To do this, the business should consider arrangements such as reducing the number of personnel on site at any one time. This may include rescheduling non-essential tasks, requiring workers not directly involved with building work to work from home, utilise off-site prefabrication where practicable, do induction and toolbox talks in smaller groups, in larger spaces, or where practicable online via FaceTime, Zoom or Skype means, staggering the start and finish and break times for your staff to reduce the number of workers on site in any specific location at any given time, rearranging or scheduling works to reduce the number of trades or working staff who have to work together in a particular area of the site on any particular task, and reducing unnecessary contact with members of the public or suppliers, and restricting site access to approved personnel only, reducing the number of public and customer contact. And thirdly, workforce screening. And we encourage workers or businesses to consider screening workers who are particularly high risk before they start work. This may include asking workers about their age, older workers, or workers who are chronically with medical issues or immunosuppressed workers, such as those suffering from cancer, should be isolated from other workers. Questions along the lines of, have the workers been overseas in the last 2 weeks? Have they been in contact with people with a confirmed case of COVID-19? Should be asked as part of a screening regime. To help prevent the spread of COVID-19, daily screening questions can be considered as workers enter the site, such as, have they experienced cold or flu-like symptoms? Have they had a temperature? Or have they been in contact with others, as I mentioned earlier? If the answer is yes to any of these questions, the worker should not be permitted in the workplace and they should be encouraged to either work from home or seek medical attention as required. If workers are permitted to work from home, they are still covered under the Work Health and Safety Act 2011. This means employers have an obligation to make sure the health and safety of their workers is maintained when they work from home. Workers also have a duty to take reasonable care for their own health and safety and to not adversely affect the health and safety of others. When making decisions about workers working from home, employers should consider, firstly, consulting with the worker, ensuring the relevant persons they are working from home is appropriate. That is, does the individual worker have an appropriate workspace? Can they maintain and keep up to date with relevant COVID-19 risks and appropriate control measures? And are they seeking advice and support should they be exposed to the risk? During consultation, employers should consider a range of factors, including the communication requirements to stay in touch with their workers, how they will manage the workflow of work, what equipment do they require to work from home, and any specific workers' compensation requirements the worker may need. Reasonable steps should be taken to ensure a worker's home area is safe and meets reasonable work health and safety requirements. An assessment of the work area should be carried out, where possible, to enable the worker to work from home safely. This can be done through either a self-assessment checklist or perhaps a video assessment of the person's workspace at home. Risks should be considered, including slips, trips and falls, workstation ergonomics, manual tasks if they are undertaking any, electrical safety risks need to be considered, and also the psychological or mental health risks of the worker working remotely if they are isolated and doing high risk, high demand work. And any other environmental factors that need to be considered. In some circumstances, working from home may not be appropriate because of the person's individual setup or because of the risks identified through that consultation. If a worker is suspected or confirmed to have COVID-19 virus, you as the employer must make sure they stay away from the workplace. You should encourage them to seek medical advice or contact their general practitioner as soon as possible. Employers or PCBUs, persons conducting business undertaking, have an obligation to notify SafeWork New South Wales of a case of COVID-19 that arises out of the conduct of the business or undertaking. So should a person be identified as a possible COVID-19 case from their work exposure, then there is obligations under the Work Health and Safety legislation for you to notify SafeWork New South Wales. You can notify us by calling 13 10 50, and you should notify if you know a worker has been confirmed, as well as you should also contact the COVID-19 national hotline on 1800 020 080 for advice on how to respond to cleaning and disinfecting the workplace and to make contact with your public health unit who will assist with contact tracing. Some simple steps to take when you suspect a person is confirmed with COVID-19 and they're attending the workplace. Firstly, you must isolate the person from others and provide a disposable surgical mask, if available, for the person to wear whilst they make themselves exit the workplace in seeking medical attention. You should, as the employer, ring the national COVID-19 hotline, as I mentioned earlier, 1800 020 080 for advice from the health officials on contact tracing and cleaning and disinfecting the work environment. You should identify who at the workplace has been in close contact with that infected person in the previous 24 hours prior to them showing symptoms. This will assist the public health unit with contact tracing as required. Those in direct contact should be sent home and isolated until further notice. You should ensure the person has transport to their home or to a medical facility, ideally travelling by their own means in personal transport, or if necessary, being escorted by someone from the workplace. You should clean the area where the person was working and all places that they have been in direct contact with. This may mean evacuating those areas until appropriate cleaning can be conducted. Cleaning should involve high-grade disinfectant as part of the cleaning process, and the cleaning staff should wear appropriate personal protective equipment. Cleaning the area where the close contact people were in common areas, such as amenities, toilet facilities, or their immediate workspace, is a priority. You should review your risk management control measures in relation to COVID-19 to ensure whether their work activity needs to change to reduce further exposure to other workers. It is important, as part of the recovery for work process and the workers' compensation process, that you stay in touch with your workers to assist them through their treatment, recovery, and return to work eventually. The current COVID-19 pandemic can cause heightened anxiety and stress for workers and the general public. Small business owners have an important role to play in ensuring the support for workers and the risk factors that lead to mental ill health is managed as far as reasonably practical. A mentally healthy work environment is good for the worker and good for the business, both physically and mentally at this time. Some actions that workers and businesses can take include managing the risk of mental health in the workplace. SafeWork NSW and NSW Health provide extensive advice on mental health in the workplace, and we encourage you to look at our website. Identifying and supporting workers in your business that may be more vulnerable to psychological injury. These could be frontline workers exposed to customer demands, or they could be workers working in isolation from home for long periods of time. Recognise the signs that your workers may be experiencing difficulties from a mental health perspective. They may be struggling or their behaviour may change due to lack of communication or the inability to have support and assistance from the workplace on a day-to-day basis. Don't forget to ask, are you okay? And follow up with support and assistance on a regular basis. Employers, managers and businesses need to lead the change, consulting with workers regularly on how their work will be conducted and supporting them through the social distancing change and the modified work conditions. Enable flexibility and consider how good work design can lead to better support and better workflow for workers, and assisting those workers who are juggling the family demands of home-based schooling and work from home simultaneously. This can be a very challenging time for many. Ensure clarity around the entitlements that can be accessed during this time for caring responsibilities for those themselves or their family members who may be experiencing ill health or potentially contracting the virus and needing to work from home or support others who contracted the virus. Remember, workers who may be on extended leave or workers' compensation still need to be kept informed of the changing work environment and assisted in terms of their return to work. It's really important to connect with workers to the support functions that are out there. That may include those in your workplace or other not-for-profit organisations such as Beyond Blue, the Black Dog Institute, or Heads Up programs. They have a wealth of resources and telephone support to assist. If workers are required to work remotely, whether it be from home or in the field of remote regional locations, please keep them in contact on a regular basis and ensure they are supported. SafeWork NSW has partnered with the Black Dog Institute to provide a wealth of resources for both workers, managers and businesses, including free online mental health training delivered by experts from the Black Dog Institute. I'd encourage you to have a look at our website and reach out to the Mentally Healthy Workplaces program to sign up to some of these free programs. If you have workers who have time or capacity whilst working from home, these are great opportunities for them to tap into these online resources to ensure their productivity before returning back to normal in the future. So to wrap up, SafeWork New South Wales, as a work health and safety regulator, has a wealth of information and resources available to small businesses to assist them to manage through the COVID-19 crisis. Your business may be experiencing extremely difficult times due to reduced customer demand or due to increased customer demand and unique working environments. Either way, it's an important time for you to support your workers through this difficult time. It's also a very important time for you to proactively manage the work health and safety risk presented by COVID-19. You can use this time to tap into resources available for running business once it returns to normal, or for assisting business through this very difficult time. Resources include the newsouthwales.gov.au website for everything to do with COVID-19 and the government support for you. SafeWork New South Wales for both COVID-19 resources and for others that may be suitable for work health and safety in general. A great opportunity to tap into training and development for your workers at this time. Again, New South Wales Health has all sorts of information in relation to the public health orders and how they impact on your business. And SafeWork Australia has industry-specific tailored information for businesses that work across borders, and it may also be useful for your needs. As I mentioned throughout this presentation, it is vital that you consult with your workers, both when they are working remotely or when they're in the office or in the work environment. You should consult with the workers about the issues associated with COVID-19, the potential risk of exposure, and the methods for controlling that risk. You should regularly review your controls as the circumstances change. As the virus and the pandemic progresses, you may need to increase or reduce your controls proportionate to the public health orders and the type of business that you undertake. You must plan now for how you will respond to a positive case in your workplace, should it arise. So put in place a system of work that yourself and your managers know how to respond should someone identify with symptoms relating to COVID-19. You should also commence planning for how your business will return to normal, gradually scaling up as the community recovers from this pandemic. This will be a prolonged process that will require a staged approach to returning to business as usual, and it's vitally important that your business can respond promptly whilst managing the risk of COVID-19. I encourage you all to look up those resources, to put in place proactive steps to manage COVID-19 risk in your business, and I wish you all the best in providing a safe, healthy and productive workplace over the next 6 months. Thank you.